Welcome back to Community Guide, and in this screencast we're going to cover the progression of planks and side planks from A to E. So it's much better to master a level that's just below your full challenge level and to build from there. And the following guidelines that we're going to cover are to help us progress the planks and side plank poses that are presented throughout this book. So let's go through the material that we're going to be covering the anthropometric measurements, the body angle, the contact area instability, the distance, and lastly the effort that we're requiring or looking for from our clients and our patients. When progressing a plank and side plank, it's really important to take into consideration an individual's height and weight because they will have a significant impact on the intensity of the pose. Taller individuals will have and heavier individuals will have more relative load on their core compared to shorter individuals. The longer lever arm will incrementally increase the load. The weight of the individual and also how the weight is distributed will affect certain planks and side planks. Larger breasted women will have more load on the shoulder, or heavier hips will have you distribute the load differently. And so those are all things that we as healthcare and fitness professionals need to take into consideration when prescribing the most appropriate plank and side plank. Next is the angle that's created at the body, both at the whole body from the surface that we're doing the plank and side plank from, as well as the different angles that are created at our joints. And so first of all, let's look at the entire body angle. So here if you look at the photo on the right, and if you drew a line down from the ear, shoulder, hip, and knee, right down into the ground, and then another line across the floor, that's the angle that we're talking about, the entire body angle. So the more horizontal that angle, the greater the resistance in this plank and side plank. The more vertical, the less the effect gravity will have. So in this second one, there's obviously a greater effect of gravity, and with the previous photo and in your manual, you'll see the greater body angle that reduces the load on the shoulders, the neck, but then increases demand on the hip girdle and lower body joints. So, moving on, we'll look at the angle created between the upper arm and the torso, between the humerus and the torso. So the greater the shoulder angle, the greater the strain will be on the shoulder joint. Here, when the hands are placed directly underneath the shoulder, that's going to have the least amount of strain for this plank posture. As we increase the shoulder angle, not only will we increase the demand on the shoulder musculature, but also on the core musculature. And so as I'm walking out here, you'll see the greater angle, and it's the importance here is that there is a higher risk of strain to the shoulder. So planks done outside of hands being directly in line with the shoulder should really be reserved for individuals who have the shoulder strength to do so safely. The next body angle that we want to take into consideration is the angle that's created at the hip joint. And so if we look at the plank, and we're looking back at the first plank, but here taking into consideration the hip joint angle. Most planks and side planks, as prescribed through this book, are done and demonstrated with the hip at a 180-degree angle or a straight line. So the straight line being created from the hip to the shoulder and from the hip to the knee and ankle. This is the hip angle both in the plank as well as the side plank position. When they have done studies looking at the amount of muscular force required to hold the side plank in a flexed hip position versus a straight hip position, the straight or the 180-degree angle has a much higher demand. And so looking here at the side plank, and here this would be a side plank with the hip shown in a 180-degree angle versus the side plank where the hip is at a lesser angle, so it's probably at about 120 degree or 110 degree angle here. And so again, the muscular analysis of the side plank shows less activity when there is flexion happening at the hip, as opposed to the line being a straight line with the hip and the rest of the body. Okay, next point to consider when progressing somebody through their planks and side planks is the contact area and the stability. So not just the surface itself, but how much surface area that is allowed or created at the point of contact. So there are limitless planks and side planks that can be created just with playing with these two variables. The more unstable the surface, the more challenging the pose. So here's an example of the plank being done on medicine balls, and for someone who has weakness around the shoulder, this can be a significant increase in challenge from doing a plank done on a step. Also, the smaller the point of contact, so if you reduce that and bring the weight onto a single medicine ball, the more intense the pose, the more demand is required within the shoulder girdle. However, at times, and again, depending on your client, you might find that if they have weakness on one side versus another side, this shared medicine ball pose may actually be easier than a hand under each medicine ball, because of the ability of one shoulder to add some support or stability to the other shoulder. The clothing and footwear that someone wears to perform their planks and side planks, for a lot of athletic and elite individuals, they don't even consider this at all. But for beginners, I often hear my clients tell me, "Oh, I can do this plank or side plank as long as I'm wearing this, or as long as I'm wearing my running shoes." And so certainly at a beginner level, the footwear, the more stable it is, or the more grip that is provided by the clothing and the footwear, can make a huge difference between success or not in that plank or side plank that's performed. The fourth area of consideration when prescribing planks and side planks is distance. The greater the distance between the point of contact and the core, the greater the challenge that will be experienced during this pose. For example, a plank from the feet will be much more demanding than a plank done from the knees, or a plank or a side plank used. In the planks and side planks, we get to use the body's lever system to vary the resistance. And an example here is when we can, in real time, start changing the distance that the ball is from the core. And so if the ball is under the hips, the intensity on the core musculature is much less than if the ball is under the thighs. And gradually, as the ball moves further and further away from the core, so that's under the knees and then the shins and then the feet, this gradual progression or distance of the ball away from the core, and hence the point of contact on the ball away from the core, is a really great way for us to be able to vary the intensity of a plank or side plank. Juan Carlos Santana introduced me to this concept of progressing a push-up in its essence of stability ball training, since a push-up, after all, when well executed, is a plank in motion. And so certainly if we want to have our clients experience success even in push-ups and all the other exercises, then experiencing success through planks is imperative. And lastly, in the progression of planks and side planks is effort. So where is it that we want the effort to be placed? The choice of a side plank is dependent, and plank is dependent on what our therapeutic goals are. Are you choosing the plank and side plank to increase ankle stability, to add variety to a shoulder stabilization program, or simply to challenge the core? Performing a plank from your hands with straight arms will challenge the shoulder musculature much more than doing the plank through the forearm. Straight arms will challenge the forearm musculature, the triceps, and place a much greater load on shoulder stabilizers. Although the plank and the side plank poses are often prescribed as exercises for transverse and oblique abdominals, they're also very effective to address other joints that may need attention. An example here is a client who's mastered a plank on 2 feet, but who has weakness in their hip or ankles. They could be challenged to progress to a single leg plank as part of their conditioning program. Lastly, the planks and side planks should not elicit any strain in the back. The strain should really only be felt in the abdominal musculature, be it in a plank or side plank. If there's back strain while doing the pose, the hold times can be reduced. Don't always have to change the position, but that is another option. The position can be modified, reducing the hip angle, so lifting the butt up in the air, creating more flexion at the hip, or more appropriate pose should be selected. If back discomfort persists, your client should stop, and then it's up to you as a professional to reevaluate their technique to ensure that the correct muscles are being used. Many people manage to do the plank by activating muscles other than those originally intended, and then the benefit is really lost and the back can be strained. And so as a healthcare professional, I encourage you to go through the steps of assessing, progressing, and helping your clients in feeling the success and the empowerment of the great benefits in the poses offered in the planks and side planks. So that wraps up the screencast on progressing from A to E, and I thank you for taking the course and hope you enjoy going through the beginner through elite level planks and side planks. That's all for today.